Time you do start to see an excellent response. You can see a little blanching there, so you know you're a little bit superficial. I'm going a little bit deeper. And sorry, I'm trying to stay out of your way. Okay. So that gives us a little bit less of an indentation. And I'm just going to treat some of these little lines to the side. Sometimes I like to see it elevated a bit, only because I know that over time that'll help to smooth the line out. So I don't get too worried if I see a little bit of the effect of the Restylane on the skin. And then I'm going to just attack this line here. And I don't have to go very deep. The skin is thinner in this area, so it's a little bit easier. And you will probably be able to see a little bit better as I administer the Restylane. You're just going to tilt your chin up just a bit. Make sure that you're comfortable. That will help to place the filler in the right plane. So again, I will mention that you can see a little bit of this elevation here, but the Restylane is hydrophilic, that is, it will absorb water, and that will help to puff out that defect, and it will smooth out over the next 24 to 48 hours. You're a little superficial there, you can see that, so you know what it looks like when you are. Again, these areas usually will resolve on their own. There is a material called hyaluronidase, which is a material that will help to dissolve the hyalurons, and that way if you get defects like this and they don't disappear, you can inject them and get a very nice response from it. So now I have administered approximately another half of a cc of Restylane to this horizontal mental fold that Kelly has here to try to elevate that a little bit. And this we can massage and move around a little bit to make sure it stays in the right place. And also to this submandibular line that she's developing around the edge of the jaw. And I don't think that she was quite as uncomfortable with this because this area isn't as sensitive as other areas on the face. I'm here with Kelly today. Kelly was treated approximately 2 weeks ago for some defects that she was concerned about in developing lines around her face and some aging defects that we wanted to correct. So I'm very pleased with the result. I think she has a nice youthful appearance, and we are going to give this hopefully 4 to 6 months before we need another treatment. has some concerns about some scars that she has on her face. She has some deep scarring on the left side of her nose from, I believe, old chicken pox when she was a child. This is one of the multiple uses of fillers, and it's one of the excellent uses of fillers, which is to try to elevate these depressed scars that patients may have, just about any place, acne scars as well, to help them feel a little bit more comfortable about their presentation. So what I'm going to do is try to inject a little radius into these scars on her nose. I've already given her some topical as well as local anesthetic. The radius is the calcium hydroxyapatite. This is a substance that's found in bone, and this is a thick solution that looks a little bit like toothpaste. It goes in the subcutaneous tissue, so it's one of the deeper fillers, and it should last a year or more. Some people say it can last up to 2 years. So I've already loaded the needle. Just going to recheck it. You don't want to inject any air. Okay. Let me just turn her to the right and see these scars here. That's the deepest one. I'm just going to start here with this big one. And if it's more comfortable, you can close your eye. I'm going to start back here behind the scar so I can get this down in that tissue, get it right underneath it. It's a little bit tricky because you're so deep you can't really see exactly where the needle is. And this is the one time you can use this solution in a bolus. Get a little bit closer. Sorry. Usually we do linear threading with this material. And let me come down here. We're getting a little elevation. It's not significant, and you can see the nose is such a sensitive area. We're getting a good result here. It's also very tight, so looks like I'm pressing hard, but I'm not getting a lot of material out. It's going in very slowly. Let me just put some pressure on that. I'm going to go for one of these here. See what we can do here. It's a little hard, very tricky. It would be easier on the cheek because there you have a little bit more skin to work with. But if you look closely, I think you can see that we're getting some elevation. I'm going to come around to the right side so I can get a little bit of a different angle. I'm going to tilt your head a little bit more toward me and see if I can come down on this one. Really good. Getting a little blanching there, but it's not staying. Just going to put some pressure so it stops bleeding. It's possibly 50% less depressed than it was. And this may be a good place to start because what we're hoping will happen is that she will have the connective tissue redeposited underneath and in between the calcium hydroxyapatite crystals or microspheres, and we'll just take it one little layer at a time to see if we can get this to come up. I don't think we're going to get our complete correction today, but I am positive that it's actually a little bit more elevated, and she's so sensitive. I just don't want to go all over her whole nose, but let me just turn your head to the right a little bit more. Hopefully you can see that it looks a little bit less depressed, a little bit more